Hello, YTPC. Ethan, Parsimonious Piper here. Today we have Morsels for Mental Manducation. After a week's hiatus because of a holiday, in my 2-star Pipe by Lee Small Dublin, I have got some Watt City Slices Nor'easter. Another sample that I received from NW Piper. This is an American blend. It's a kitchen sink, but it's not just a mishmash. It's a complex Latakia, Burley, Virginia, Black Cavendish, Orientals, Perique, cigar. Literally every kind of leaf you can think of. Except maybe Dark Fire, Kentucky. Y'all need to throw some of that in here. So far, very good. What I taste mostly right now is the smokiness of the Latakia and a little bit of the sourness of the Orientals. Those are the highlights that are hitting me. So, today's morsels. Like I said, after a week's hiatus, we are going to start off with a pop quiz. Which of the two major American parties doesn't believe that you as a law-abiding citizen should be able to own a semi-automatic AR-15 or have ammunition clips, as they call them, magazines, that hold more than 10 rounds, but left billions of dollars worth of real American weaponry and weapons of war and assault rifles for the Taliban? Yay for terrorists, nay for thee. There is only one correct answer. On September 3rd, Rolling Stone published an article stating that hospitals in Oklahoma were so overrun by COVID cases, or by ivermectin overdoses, that they were not able to treat people with gunshot wounds. Quote, gunshot victims left waiting as horse dewormer overdoses overwhelm Oklahoma hospitals, doctor says. Yes, people in Oklahoma are overdosing on horse dewormer. That story was retweeted all over the Twitterverse, and similar versions were run in many other mainstream media outlets, including MSNBC's Rachel Maddow, the UK's Guardian, BBC. The story, of course, has turned out to be completely false. It has been debunked. There are not loads and loads of Oklahomans who are overdosing on ivermectin, and gunshot victims are not only rare in Oklahoma, but are not being turned away. Now, have any single one of those had their social media yanked for spreading misinformation? Yeah, I'll leave the answer to that one up to you. 2 days later, on September 5th, CNN's Jim Acosta had Dr. Fauci on. Gotta love it. Referring to ivermectin as a livestock drug. Little news flash for you folks. Ivermectin actually won 3 gentlemen the Nobel Prize in Medicine in just 2015 for human use. This is not a livestock drug, although it is frequently referred to that way. The CDC even recommends ivermectin treatment for refugees who are coming to the United States from places like the Middle East, Asia, North Africa, Latin America. Now, have Fauci, Acosta, or CNN had their social media yanked for spreading misinformation? Yeah, silly question. Let's get relit. We're seeing an increased nationwide push for mandatory mask wearing in schools. CDC's morbidity report last Friday included a report from August 20 to July of 21, August of 2020 to July of 2021, a year's worth of data on juvenile statistics. In that year, in the 0 to 17 age range, COVID mortality was 0.4%. Draw your own conclusions. Yes. It seems we have been inundated with bad news about the COVID surge in Florida. All of it seemingly due to the lack of meaningful response by the state's Republican governor. The situation, according to one newspaper, and I quote, "Hospitalizations could peak over the course of the next week. They're higher than ever before. Hospitals are full and have been for several weeks. That isn't going to change anytime soon. This is the exact place that we were trying to avoid with 1,200 hospitalizations and nearly all hospital systems feeling overwhelmed or having to postpone or cancel other types of care. This is what we were trying to avoid. We are in that crisis," said Dr. Peter Graven. Oh, wait. That quote was from Oregon. Oregon is a state that has mandated the vaccine for practically all public employees. Its vaccination rate is nearly identical to that of Florida. Oregon has also become the first state to reimpose a complete requirement for wearing a mask, even outdoors, for everyone 5 years old and older. Oregon is experiencing a surge extremely similar statistically to Florida's. Why aren't we hearing about that? I'll give you one guess. Yes. The National Archives. The National Archives have labeled as potentially harmful content all of our founding documents, including the Declaration of Independence and the Constitution. No, that is not an Onion headline. Another relight. It's a little wet. I didn't give it much dry time. I didn't want to kill the flavor. So I am having to relight, and I'm talking. The NIH just announced that they're starting a study on the effect of the vaccines on women's reproductive health. Let me quote for you. National Institute of Child Health and Human Development Director Diana Bianchi. Our goal is to provide menstruating people, for the rest of you out there, that's healthy premenopausal women, with information, mainly as to what to expect, because I think that was the biggest issue. Nobody expected it to affect the menstrual system because the information wasn't being collected in the early vaccine studies. End quote. Ignore, if you can, the wokeness of that statement. The more frightening thing is we are being pushed, mandated, to take a jab of something. The safety to women's reproductive health, much less men's, has not yet been studied. They weren't gathering data. But it's safe. What could possibly go wrong? Still with this particular topic, and our big final item for the day. Over at the CDC, they've been busy redefining definitions. Let me tell you what two definitions were prior to September 1 on their website. Vaccine, a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. And vaccination, the act of introducing a vaccine into the body to produce immunity to a specific disease. Those definitions are no longer on their website. What's there now? Vaccine, a preparation that is used to stimulate the body's immune response against diseases. Note, a vaccine is no longer defined as something that produces immunity. Just stimulates the response of the body. A vaccination. A vaccination is the act of introducing a vaccine into the body to produce protection from a specific disease. Again, notice, now vaccination produces protection from, but not immunity to. So we have changed the English language very quietly, not terribly subtly. Keep that in mind next time you hear this discussion of vaccines and vaccination, that we are no longer talking about the same thing that we were talking about when there was a polio vaccine or a smallpox vaccine. These are not the same thing, even though they are using the same language. The conversation has shifted. 1984 is here. With that, folks, have a good day. Light something you like. Enjoy your afternoon.